Hi, this is Jens Torsen of the Hartman Group. Thanks for joining me to review a Hartman program on the individual mandate, an important aspect of the Affordable Care Act. Our objective today is to provide you with some general information around this fundamental aspect of healthcare reform. The agenda will follow will address some of the following questions. What is the mandate? What does it require? Are there any exemptions? As well as some identified references and resources. Finally, as always, we'll provide our primary takeaways. Please keep in mind that our intent is to provide some baseline education, and any need for tax or legal advice should be received from appropriate counsel. Now, a fundamental aspect of the law was a broadening of the insured pool across the USA, and one strategy employed to accomplish this was the individual mandate. Essentially, after January 1st of 2014, there will be a choice between A, getting covered under a qualifying health insurance benefit, or B, paying a financial penalty. So, what are the penalties? Well, they're going to change over time. Initially, they'll be set at the higher of $95 per person or 1% of income, and over time, they'll increase in 2016 to $695 and 2.5% respectively. Now, on the flip side, given the substantial cost of insurance, the government will also establish some methods by which to provide subsidies, and two of the conditions that will be considered there are income relative to the poverty limit, as well as whether affordable coverage is available at work. So, it leads to the question, will anybody be exempt from the mandate? And the answer is yes. Included in the exemptions are those that meet certain religious qualifications, undocumented immigrants, and those with incomes below certain thresholds. So the details from this presentation are largely sourced from the NFIB website. But there's also a lot of other very good information out there, including from Wikipedia, the Kaiser Foundation, as well as from most insurers and health underwriting associations. One example that's particularly good is a calculator from the Kaiser Foundation. This provides, based upon some simple data points, some estimates of what sort of subsidies would be available in a hypothetical scenario. So, in summary, most Americans will be required to have insurance effective January of 14. There are some exemptions. Implications of not fulfilling the mandate include financial penalties, and changes, including the mandate, as well as other aspects of the law, will ultimately absolutely impact the employer-sponsored group insurance market as well. Now, we take tremendous pride at Hartman in working within our team to stay at the forefront of the changes in our industry and distill the information into something more specific that is useful. Please let us know where we can help you and your organization, and thank you again so much for your time.